Hello, and welcome to the fourth in our conversations about getting the best from GPCPCS. I'm delighted in this episode to be speaking with Dr. Farzana Hussain, who is a GP in the project surgery in Newham and also the clinical director of Newham Central 1, PCN. Farzana, kind of you to join me. And the purpose of these videos is just to share some conversational experience about how you or how we are getting the best out of GPCPCS. So I'd really love to hear about how you got going with GPCPCS within your own PCN and practice.
Thank you so much for having me, Michael. I'm delighted to be here. So all I can say is CPCS has been an absolute godsend for us, both for myself as a practice. I run a list of 5,000 patients, and I've been working in Newham as a GP partner in my practice for 18 years, and our PCN is one of the largest PCNs out of 9 in Newham. We look after 67,000 residents made up of 7 practices. Now, of course, it's no surprise to anybody that we're living in COVID times. We all know that we're sort of thousands of GPs short, whether you look at 6,000, 5,000, whatever figure is quoted. And actually what happened, Michael, was that something that's never happened before in 20 years of my working as a GP is that we were just turning bags of people away over the last few months that simply couldn't get an appointment. We had made all the efficiencies we could. We'd gone to telephone consultations, online consultations, any way we could, but we simply didn't have the doctors to be able to deal with those patients. And of course, many of us had been using what was called the minor ailment scheme before. I'm really fortunate. I've got some absolutely brilliant community pharmacists near me, and we work with a number of them. And one of them who is our community pharmacy PCN lead as well. So as well as having known Mr. Jignesh Patel for many, many years, who's been just an absolute godsend to our practice. He helped tell me about the scheme and really helped us a little bit with the training. Now, I'm really pleased to say that at the practice, we've been running this for over 6 months now, and we on an average week would probably send about 16 patients minimum through to the CPCS. So if we really think about what that means, 16 patients is a whole GP surgery. That's a whole clinic where I would have a locum GP or a salary GP. So for me, what's not to like as a GP and an employer? I am getting free service from our community pharmacists. What's not to like for our patients? There's never been a time, Michael, where I have been diagnosing so much cancer, whatever the factors for that, whether it's been people staying behind in lockdowns, not wanting to bother the NHS. Where I am in Newham in East London, we are an area, us and Brent, are an area of late diagnosis cancers anyway, for lots of reasons. So it's just so great to be able to give access to patients. One of the great things about the CPCS is that there are so many conditions. We talk about minor conditions, but there are so many conditions. My receptionists just have the chart on their on the back of their reception desk. Diarrhea, constipation, common cold, earache, so many things that our community pharmacists can deal with. Now, when I was trying to roll this out with our PCN, 7 practices, obviously every practice has slightly different individuality, because there's no problem with that. But rolling things out obviously takes a little bit more time, and basing it on the success of our practice. What was really interesting is one of the things that we all think about as healthcare professionals, is this safe for patients? What is the safety net loop? But this is really easy, actually. GP practices for a while, since the pandemic started, we have had a sort of a 111 slot that we've saved in our appointment book. We as the practice just used the same thing. We used a pharmacy slot where our community pharmacists can just ring through or email through and book straight into that. Michael, I'll tell you that we have a slot a day. We probably only utilize that slot for the pharmacist once a week, if that. Under 10 to 20, and I would say under 20% come back. And of course, then we can use that slot for another patient anyway. So that has worked really well because it gives our pharmacists the confidence that they can book. We often know that the risk occurs, doesn't it, at any interface, whether that's hospital to practice, whether that's community pharmacist to GP. It's not a wasted appointment because some might say, well, that's an appointment you're taking. The way I look at it is, yes, but our pharmacists are giving us 16 appointments a week. Actually, if you're looking at it big jigsaw puzzle picture. We need to stop thinking about where the GP practice, there are community pharmacists, but actually what access can we collectively give our patients. The training was really simple. You know, I didn't need to go on it. My reception team went on it literally 3 hours, really just to think about, you know, what things are red flags that you might not send. Even if you have a little snooze in the training, they give you flow charts, they give you information that, you know, you can have later, and just a little bit about how the information comes through on Sonar through an email. It really isn't difficult. Most practice staff are used to dealing with a lot of information coming through from hospitals, so that there's nothing that's dramatically hard about learning this. So far as a practice, we would never go back. We just want to say a massive thank you. Our patients are getting a better service for it. As a PCN, we've now got a number of practices that are rolling it out, and another few who are in the process. They're just going through their training at the moment. And of course, this year, Michael, we know that although for COVID, one of our targets that we have to hit as PCNs, we call it the Impact and Investment Fund, the IIF. A lot of the indicators were paused for COVID, but we know that from April 22 that everything will be coming back, and referrals to the CPCS is part of that. There are a number of referrals that we need to hit. I'd hope that we were going much higher than that very minimum target. I've just been reading well, I haven't been reading it all actually, but you know, the general practice, the general practice bit of the NHS operating guidance that came out over Christmas, and the aspiration is that 2 million appointments will be provided by the GPCPS service as we go forward, and I think that is such a support for general practice. A lot of this, of course, was really useful to have those relationships with our community pharmacists as well. It didn't feel like we were, you know, working with aliens, people we didn't know. And having a PCN has been really helpful because, as I said, we've got a community pharmacist PCN lead who really kindly cascades information to the other pharmacists. And then, of course, each of our practices has their local pharmacist. So if anything, we've got secondary benefits, not just from CPCS, but other things like prescriptions and all the joint working that pharmacists and GPs do together anyway.
That is a great story, and it sounds like you've really captured the spirit of practical collaboration there, built on kind of trust and relationships. I mean, is there anything that you would close with, Farzana, in terms of it? I mean, it sounds like you've really got this going and growing, and it sounds like you want to keep it ongoing as well. And it sounds like your PCN leadership, they're going to kind of spread and adopt as well. I mean, as you think you said, what's not to like, really, you know?
I think what's not to like, I think the only, I suppose, thing I would say is for people who are a bit nervous about it, I know a lot of people feel a bit nervous. Many GPs feel, oh, is this something that it's a different way of working? We know that all changes, it takes a little time. Change takes a little time. We're all human beings. Change is a bit scary for all of us. There's nothing wrong with that at all. And setting things up takes a little bit of time. But if we put that short-term time investment in it, then we get a lot of gain. So my reception team trained for 3 hours. Then we got a little bit of the first few weeks just thinking about how many are we passing, our reception happy to pass it, our patients happy to go. So just putting that little bit of time in at the beginning. As I say, now we've got an entire GP's clinic that is safely managed by by some of our community pharmacists. What is not to like? So I would say just go at your own speed, that it's okay, it's no problem. Don't be afraid of it. Give it a go. If something isn't working, pick up the phone to your local community pharmacy. They're very sweet people. Pick up the phone. They're generally happy to speak to us GPs. So, you know, do that and give it a go.
Thank you. That's really lovely. I really appreciate you sharing your experiences. So look, folks, thank you for watching. Farzana, share that, and for myself as well. Our contact details will come up at the end of the presentation, and I would love to hear from you if there's anything that you would like to know or share about your journey on GPCPCS. And we'll also make sure that we put Farzana's Twitter handle up there as well. And if you want to follow her and hear more about her great stories about making new ways of working happen by collaboration, then join her and watch what she does as well. Thank you, Farzana, again. Thank you, everybody, for watching.